Hello, and welcome to NETEC's next COVID-19 webinar. Today, we're going to be talking about overcoming challenges to supporting our workforce. My name is Amanda Grindle. I'm extremely honored to be your moderator for this webinar. I'm located in Atlanta, Georgia, and I'm a faculty member of NETEC. I run a pediatric biocontainment unit for Children's Healthcare of Atlanta. I think this webinar is extremely pertinent during this pandemic today, and I'm really excited to give you this information. So today we have two incredible speakers, Dr. David Cates and Trish Tennill. They're going to talk about what are sources of stress for healthcare workers, what obstacles there are to supporting those healthcare workers, and what is leadership's responsibility in supporting those healthcare workers. Then I'll come back on. We'll have a few question and answers, but we'll also do that throughout the webinar. And then I'll also give you resources that NETEC has to offer at the end. For those of you who are not familiar with the National Emerging Special Pathogens Training and Education Center, we are here to help increase the capability of the United States public health and healthcare systems to safely and effectively manage individuals with suspected and confirmed special pathogens. We do have a website at www.netec.org that has a wealth of information and resources, or you're more than welcome to email us at info@netec.org. This webinar today will be recorded, and in 24 hours will be posted to that website below for you to share or reference. So what do we do at NETEC? NETEC, we have several arms. One of those which is an assessment or self-consultation. We allow for readiness and self-assessments. We also develop and help measure metrics for facilities and healthcare workers. And then we also can provide virtual and on-site assessments. We also have a large education branch. These are self-paced education through online trainings, virtual, simulation trainings, or in-person courses. We also have a variety of webinars like this one you're attending today. We also offer technical assistance that can be on-site or remote guidance. We have a very large online repository full of tools and resources. We also have a large array of exercise templates that use and are based on the HCEP model. And lastly, with this branch, we are able to provide emergency on-call mobilization if necessary. And last but not least, we do have a research network that comprises of an online repository that's very robust. We help develop procedures, protocols, and data capture tools to facilitate research. And then we also have an infrastructure for a biorepository for specimens. So without further ado, I'd like to invite our speakers today to go ahead and unmute their microphones, turn on their videos, and Dr. Cates, I'm going to let you introduce yourself first.
Thanks so much, Amanda, and thanks everyone for inviting us today. I'm David Cates. I'm the Director of Behavioral Health at Nebraska Medicine, and I'm the Behavioral Health Consultant to the Nebraska Biocontainment Unit and the National Quarantine Unit. And with me is Trish Tennill, and I'll let Trish introduce herself.
Hi guys, my name is Trish Tennill, and I'm Associate Director of Nursing at Health and Hospitals Bellevue in Manhattan. I'm also a NETEC SME for infection prevention and skills and simulation. And I also am their nurse lead for our special pathogens unit, or as we affectionately call it, the SPEW for Health and Hospitals Bellevue.
Thanks, Trish. And we are hoping to make this webinar as conversational, as interactive as possible. So we've organized this around a few questions. And these are actually the questions you answered when you registered for the webinar. So what we'll do is we'll start each section by asking Trish to answer the question. Then I'll share with you what you all said when you answered during registration, and then present some additional information from the literature on the topic. We'll invite you to comment as we go along to add additional ideas in the chat, and Amanda will be reading those out as we move through. And if you have questions, put those in the Q&A, and we'll see if we take them at the time or if we do those at the end. So we're looking forward to interacting with you, and let's get started. Our first question, and Trish, this goes to you first, and then we'll see what everyone else said, is what are some sources of stress for healthcare workers during this pandemic?
Well, I guess I'm going to do a little bit of self-disclosure today, David, because I want to tell you guys a little bit about my position during this pandemic. I work at a Midtown hospital in Manhattan. It's a public hospital, and I focused mostly on special pathogens, but I helped in our COVID response by helping distribute PPE, doing just-in-time training for staff and PPE, helping develop and run our proning team. So I was kind of out of my element when we first started this response. So, one of the sources of stress for me was that I had to change my position and change the outlook of where I was working and what I was doing. I was nervous that I was going to get sick or my family was going to get sick. In fact, we stayed at hotels, and when the air conditioning went out one night, I got really hot and I thought I had a fever and I thought I was showing signs and symptoms of COVID. So I got up and I smelled my toothpaste to make sure that my sense of smell and taste were still there. And to this day, I still sleep with toothpaste under my pillow. I think it's just a habit now. How long will my vaccine last? Because we really want to see everybody vaccinated, but am I going to have to get a booster? What's going to happen? Watching my staff, I don't really technically have a staff, but I'm very close to our special pathogens team. And watching all these nurses and environmental service workers and doctors, they've changed what their job responsibilities were. They're working 24/7. Some people didn't go home. We stayed in hotels. So if they needed us, we could come right away. Watching them trying to deal with this, and, when will I have time for myself? And I think everybody's asking that question. We've worked so hard over the past year. When am I going to go back and have time for me? But as I could go on for hours, but I'm going to pass this over to you now, David.
Thank you. And many of the sources of stress you mentioned, we also see here at Nebraska Medicine. And as I've met with nurses, I really appreciate it. It's a great way to get the conversation started, Trish. Let me share, if I can, what everybody said in the registration questionnaire. So first of all, just to orient you, this is a list of sources of stress for healthcare workers that comes, believe it or not, largely from the literature on SARS, MERS, and Ebola. I didn't really have to add much with COVID, and there is now a literature on COVID in terms of healthcare worker stress, because really highly hazardous communicable diseases tend to cause similar sources of stress. And so this list is really fairly universal for infectious disease outbreaks. What our participants said, the number one source of stress was increased workload and limited rest time and fatigue. And Trish, when you talked about when am I going to have time for me, I think that's exactly what this is reflecting. You also talked about staying in a hotel. Obviously, that was to protect others from you, so safety of family and friends. And of course, concern about yourself, fear of contracting the illness, jumping ahead to number 4. Number 3 from our participants today was inadequate staffing and surge of patients. And one of the things that, of course, I think all of us have seen is when there's a surge of patients, there's a surge of COVID in your community, and that means among your own staff. And so you are working at exactly the time you need your staff with fewer staff because people are out either in quarantine for a high-risk exposure or isolating for a positive test. So I think very much in line with what Trish was describing. And then the last or the 5th highest ranked item was proper use of PPE, which was combined with infection control protocols. And that's something we've seen a lot here. Every time we change the protocol, we have units that we convert to COVID units when we have a surge, and then we decommission, they go back to regular med-surg units. Sometimes we cut the units in half. People are deployed in different work groups. So we also see stress around changes in, workflow and responsibility, depending on what unit someone's on, depending on what the latest guidance from the CDC regarding infection control procedures, and of course being separated from colleagues as a result of all that workflow change. So I guess this would be a good time to ask our participants to just, if there's something you don't see reflected here, throw that in the chat. Love to hear from everyone else about what sources of stress you are seeing in your workforce. So while those come in, I will briefly summarize some literature on what we're seeing, and then we can take a look at what came in through the chat. So I'm not going to go through all this, don't worry. This is just a sampling of research from Italy, Belgium, United States, and China. And the literature has really been of two kinds when it comes to healthcare worker stress. One is asking healthcare workers, what are your sources of stress? The other kind of study we see is actually assessing symptoms. What are you experiencing in terms of anxiety, depression, post-traumatic stress symptoms? And I'll just call your attention to the bottom study on this list, because what we're seeing is rates of depression among healthcare workers and the general population around 14%, anxiety 15%, insomnia 37%. This was the one item that was higher among healthcare workers than the general public. And by the way, it's totally squares with my experience. I've been rounding on our COVID units throughout the pandemic, especially in the beginning, and especially as things change, our sleep disruption. I would say 9 out of 10 nurses and care techs I spoke with in the beginning were having trouble sleeping. And PTSD, as I mentioned, 21%. What's interesting about these statistics are these are single point in time prevalence rates. So the World Health Organization tracks prevalence globally, and best estimates are far below what we're seeing now during the pandemic. One example, in the United States, post-traumatic stress disorder, in any given year, about 3.5% of the population is estimated to have PTSD, lifetime prevalence of 7 to 8%. Here we're seeing 21% at the point of the survey, whereas normally lifetime prevalence of 7 to 8%. Now you can argue that the data we're collecting is questionnaire data versus face-to-face interviews, so that could account for some of the difference, but these are really concerning rates of psychiatric symptoms. And in terms of sources of stress, it's many of the same things we just talked about. You can see some of the sample findings: getting COVID, transmitting it to family, transmitting it to other patients, being overworked. So let me just pause and see if anything came in on the chat, Amanda, that you can read out for us in terms of additional sources of stress.
Absolutely. The highest one that came in multiple times were the frequent changes in guidance protocols and recommendations and the stress that created. I'll pause there before I read a couple more to see if you have any comments.
Yeah, and that is one of the things that we've seen in the literature, again, even before COVID. It's people, when they come to work, they want to know what they're doing and they want to feel competent. One of the most important ways to manage stress is to have a sense of control and a sense of competence. And what happens when we change protocols is people have to relearn, they have to think about things that are normally automatic, and that has an increased cognitive load. So I appreciate people posting that in the chat, because that makes a lot of sense in terms of the frequent changes that we have seen in protocols. And even when the protocols stay the same, if you redeploy staff from one unit to another unit, they have to do different, learn different protocols for those units if it's a non-COVID to a COVID unit. What else did you get, Amanda?
There were a couple talking about the severity of the variants and effectiveness of vaccines and what potential that has for increased complex care of patients. And several people wrote about the media and their involvement, some of the racial unrest that was happening. And then also people were talking about families, friends, others not really taking the pandemic seriously, and that having extra stress on trying to care for yourself and patients while others really kind of did their own thing. And I'll pause there before there was one or two more after that.
Yeah, I don't know, Trish, if you want to comment on any of those, I don't mean to be the one commenting.
No, that's okay, because, I will tell you, like, I'm reading a lot about the insomnia, and I'm trying to think how we can get a 3 o'clock Zoom meeting for those of us who wake up at 3 o'clock in the morning and need somebody to talk to. But like, I'm also thinking about the variants, and especially because of this outbreak in India right now, and the fact that, they're going to start increasing flights back from India, and we don't know much about this Indian variant. It's scary. It's scary to think about something like that. I don't know. That's just one of the really big things I'm worried about right now.
I'm just going to go back a second to this other slide, because it's scary for several reasons. Like, one is, of course, that the variant is here, and would we be vulnerable to it? Will the vaccine cover it? But the other is, like halfway down on the left side, a little more than halfway down, prolonged uncertainty, anxiety. Trish, this is something you and I have talked about in the past. How long is this going to go on for? And it wasn't one of the top 5 in our poll, but we certainly see that in our respective institutions. And one of the impacts on healthcare workers of these variants is, is this ever going to end for me in terms of the work that I'm doing?
Yeah,
and then there was one.
Wait, what'd you say, Amanda?
No, go ahead. I'll let you finish before I was going to say the last thing.
No, I just saw in the chat about, it was a comment of faith in the infection control department to disseminate accurate information. That's been a real challenge during this whole pandemic. And it's not just on the infection control department. I think that they try, just like everybody else and all leadership, you try to get information out, but it happens so fast and people are so busy at this time, it's hard to get that information out. And I'll tell you, at the end of a 12-hour shift, nobody wants to huddle to talk about what happened or, what the new information is. So I think that's a real issue. And I think that leads to trust issues. And, I think that we're all going to need help getting over this again, realizing that everybody's trying to do the best for everybody, but it's just hard to get everything out there.
It's great. That's a great point. Amanda, you were going to maybe make a comment or read another chat.
Yeah, I was just going to close that with where there were several related to infection prevention or IP workers, the heavy burden or the responsibility that was felt with making some of these different decisions, maybe things that people weren't used to, trying to guide staff, and really the just lack of trust that might have been there prior and now. There were multiple comments about just the infection prevention and control team. And that will close that section out.
That's great. Thank you. And indeed, I think two things. One is just the changes and the updates and the information, but then Trish's point about how does that affect our trust? Do we need to wear masks? Oh, we do need to wear masks to the general public, and then the healthcare workers, what is safe for us and what's not safe. So it actually bears on the issue of leadership, which is a nice segue, not into the next topic, but the one after that. I just want to summarize in terms of how we think as leaders. I think the conclusion from the literature on healthcare worker stress and symptoms, 20 to 70% of healthcare workers experience severe emotional distress during highly hazardous communicable disease outbreaks. And for many, that continues after the outbreak. And so everything we're going to talk about from here on in this webinar will also apply when eventually this is under control, because it's not like people are all of a sudden going to feel better. You talk about rebuilding trust, that takes time. You talk about post-traumatic stress, right? So after it's over, sometimes people begin to experience symptoms because during a crisis, we sort of bear down and we just get done what we have to get done. And then when we lift our heads up and start reflecting on what happened, sometimes symptomatic functioning can actually increase. And so everything that we will be talking about, really, we have to think about long-term, not just until the pandemic ends. So let's get to our second question, which is, what are some obstacles to supporting the workforce? We know that the need is tremendous. We just talked about all the challenges. We just talked about some of the data on symptoms among healthcare workers, which are, unfortunately quite high. And we want to support them, but what gets in the way? So Trish, can you kick us off?
I can, and you may not like me for this, David, but I am just going to be fully transparent and tell everybody, I think my biggest obstacle in supporting my fellow healthcare workers is myself, okay? Because I need to admit to myself that I'm having problems and that I have, not seeking the right types of help that I need before I can direct my staff to do it, or my fellow peers. I think that is one of the biggest obstacles I have right now. And also, there's nothing I loved more than at 7:00 leaving work. There was the clapping outside, we're heroes. I'm a healthcare worker. I do this every day. I just don't save lives when somebody flashes a light in the sky. I do it every day. So it was nice to get recognized for what I'm doing, but we're still doing it. And I think that's hard for me to come to terms with and realize.
That's great. It's a great insight. And actually, when you talk about recognizing your own need for support and help, that's very much related to one of the obstacles we'll talk about around stigma, right? Because if you can share with your team, I'm struggling too. These are the resources I've used. This is what helps me. It may make it easier for other people to open up. And the reason that's relevant is because one of the top rated, so I had a chance this morning to look at the poll results. And here's what our participants said. So number one, healthcare workers often minimize their distress. So you're talking about how you have to admit it in the first place, right? Now, in part, we have to do this because we have to be available to our patients. We have to be available to our teams. And so we have to kind of put aside our own needs to function. And there's actually a term for that. We call that emotional labor, right? It's the work of dealing with your emotional reactions so you can take care of patients. And obviously it's necessary at times, but it is unfortunately reinforced by this culture that Trish, you were just talking about, this culture of being heroes, this idea that we are heroes and we put our own needs aside and we sacrifice for other people. And as a result of those forces and the emotional labor that's sometimes necessary, we find healthcare workers are indeed unlikely to ask for help when they need it. And obviously that's a fairly universal, at least among our participants today, because that was the number one obstacle that as a group we identified. But number two is stigma. And that's where I feel, Trish, if you're able to talk about what's hard for you in an authentic way, and that you're having reactions, you're having trouble sleeping, for example, it makes it easier for other people to talk about it as well. Interestingly, the third obstacle identified in our group is lack of awareness of services, like what's even available in the first place. And what's so interesting about that is we know that. And like at Nebraska Medicine, we've done so many things to make sure people know. We have it in our daily e-news blast. We post up these resources on units. We have these webinars where we talk about it. We have an intranet site, sort of a well-being section where all of the resources are consolidated. And yet still, and a year into this, I will get an email from like a manager saying, I have this, one of my people is going through this. What resources do we have available? And I'm like, you're a manager and we've worked so hard and you still don't know, but it's really hard. We have to keep messaging. Let me move. Before I do move, Amanda, are there some additional obstacles that our participants identified in the chat?
Yes, someone wrote lack of empathy, meaning people having this reaction of, well, you signed up for this kind of deal, which I think is extremely pertinent.
and depending on who that person is, right? Like if that's a leader, if that's a manager of a unit or a director in a hospital or a vice president, if that's a message that comes across like in a forum for employees, how damaging is that, right? You signed up for this. What did you expect? What you're saying is like, this is your problem. Don't come to us looking for us to solve it. That's kind of I think the what's hidden in a you signed up for it message. And that's, in my view, exactly antithetical to what we want to be communicating. And one of our questions is actually, what is it that leadership needs to communicate? So I'm not going to get into that in detail, but I thank that participant for putting that out there because, and also in coworkers, like, stop complaining, this is our job, not helpful. Again, because you close down the opportunity for talking. And really, what is healing about? Well, it's about a lot of things, but in part, it's about being able to put into words what you're going through and feeling safe. And to the extent there's stigma, you don't feel safe doing that. And to the extent you expect to get kind of slapped down by a colleague or a leader of some kind, you're not going to be willing, and then you don't get the help you need. Also, by just being able to talk about it, someone might say, oh, this is something that works for me. Maybe that would work for you. What else are we getting in the chat?
A lot of people talked about informational overload. So the well-meaning kind of emails or posters just started to get lost when everything just kept getting turned out. And then also along the same lines is a lot of people say they didn't want to talk about or do COVID 24/7. So it kind of hindered their willingness to seek help.
Yeah, excellent. And actually, that last dynamic we see in the support groups. So one of the interventions a lot of organizations have done is put together support groups, but usually, you try to do them at different times so people can get them when they're on or off shift. And they tend to fizzle, and for exactly that reason. I feel like people, when they're off work, they just want to be off work. They want to go home and then log back in. Other institutions have reported success with support groups, but we haven't seen that particular intervention. And we will talk at the end about a menu of interventions to overcome these obstacles. But I agree that kind of COVID 24/7, I think people want to just leave and be done. Can you remind me what you said right before that? Because I had a thought too.
It was information overload. So emails and flyers might be getting lost, well-meaning, but they didn't see it because it was just a lot.
Right. Yeah, absolutely. So, I mean, that's one of the challenges, because like we were talking before about changing infection practices, we have to communicate all of that. And then on top of that, we're trying to make sure everyone knows what the resources are available. And I think the answer to that is just having different venues in different ways at different times. So there are a lot of, like when I send an email, I have an automatic thing at the bottom of my email that says it's normal to be stressed during this time. If you're experiencing stress, click here and to be connected with our peer support program. We put 10 cards up with QR codes people could scan. We put them in break rooms. So you have to attack multiple venues to get the word out. You cannot expect you're just going to send one email. We have a newsletter with stories about people asking for help. We're actually doing a whole series now. One of my colleagues in addiction medicine, Doc, is talking about his own journey with addiction and asking for help. I have another colleague who's about to come forward with a problem. So we're looking for multiple venues. Anything else about obstacles, Amanda?
Yeah, I'll bring up the last one on here is just the mistrust as the obstacle with all the changes and things constantly happening, maybe mistrust at the leader level and wanting the willingness to go seek help and not really wanting to talk to or ask for help from that level of leadership.
It's great. Yeah. And so one of the things you want to do is you want to have avenues that support healthcare workers that don't involve leadership at all. So they're truly confidential. It was the last item, number 6 on this list, but I think for some employees that, they want their privacy to be respected. Of course, being efficient in terms of, or convenient in terms of time, or even telehealth for services to be available. And also making sure that there's no cost, at least to some of these services. And I think we'll address most of the idea in the intervention section today is really around how do you overcome those obstacles. Should we move on to the next question, or are there any other thoughts in the chat we want to read out?
The only thing that came in a little bit late was kind of the division in staff, that maybe travel nurses or people leaving to go get incentive pay or taking higher paying jobs really kind of created a division in the staff, and that just creating an extra obstacle.
Yeah, absolutely. So that would be to the extent that one major source of support is peer support and teamwork. And I don't even have a slide on it, but there's a whole literature on teams and what makes an effective team. And part of what makes an effective team is safety, psychological safety. And what I think that participant is saying is, like, it makes the team not a safe place. You got some strangers, you don't trust people, are they going to leave and abandon us to go make more money as a travel nurse, for example. And so that does make that avenue, and a lot of our work has been around peer support, but it's not just peers in your unit, but it's also, we have a formal structure, which I'll talk about. Trish, anything that you would like to add about that?
Again, I'm glad we're in 2 different states, so you can't come to my office after this. But, I was just thinking about another obstacle to supporting healthcare workers. And like every time I go to the floor, people are asking me the same question. When are we going back to normal? When are we going back to the way it used to be? And how do I tell them that this is the way it's going to be for a while? And maybe this won't change. Maybe we're just going to be this busy all the time. So how how do we get this message across, but in a supportive way?
It's great. It's a great point. We're going to talk a lot about leadership and messaging in just a minute. So maybe we can address that a little bit in the next module when we talk about the messages.
Okay.
I think we're ready for the next question. Amanda, is there anything else you wanted to read actually from the obstacles?
Nope. Everybody just agreeing with Trish's comment of, I think this is our new normal. So I think you're good to go.
One thing I'll say about that in terms of the new normal and the stress is when we talk about interventions, they're really of two kinds. There's sort of the bottom up, which is, like resilience training and services for the individual. But then there's organizational factors, like how do we make the work more manageable? And of course there's a nursing shortage nationally and people are struggling to get travelers, but things the organization can do to make workflows and work life better and support they can bring into the units. So, you really have to address both. And we'll talk more about that. So the next question is, what is leadership's responsibility for supporting healthcare workers? So Trish, I'm going to turn it back over to you.
I think my responsibility is to be more proactive in my approach. Instead of just saying, how you doing? Have a good day and keep on walking. Sometimes a fun-sized Snickers can open up the conversation that says, Trish, I just had a rotten day yesterday. Can I just take 2 minutes of your time and tell you about it? So I need to be more proactive and intuitive. We need to be more intuitive about how our staff feels, and a lot of times, my God, I've said this about 1 million times in my life this week. It's a communication thing. Sometimes people just want to talk or they're just misinformed or underinformed. That's my fault sometimes. I thought you knew this. I thought you knew that we were changing gowns this week. I'm sorry, kind of thing. I think too that I have to be honest with them, and I'm getting better at that because I am the queen of self-disclosure, about being more honest with my own struggles, that I'm not able to sleep, that I'm having a hard time getting back to what I just saw in the chat is the now normal, that it's hard for me too. I think that is part of my responsibility to say, yep, hard for me too. Let's work on this together and get a more cohesive, proactive approach with them.
It's great. Thank you. Yeah, being more proactive, because if you just say, how you doing? The proper answer is, I'm fine. But if you say, I know that this is tough. I'm sure you're struggling. What's the hardest thing for you right now? That's a different question, right? Then you're actually really asking a question versus how are you? Let's see what our participants said. So on the bottom half, this is the same slide before, but we add the bottom half here. So the number one responsibility for leaders, according to our participants, was they have to make service. And I think what I thought I was, but I'm wondering now, based on what Trish just said, if people interpret it differently, making services easily accessible is what I had in mind. But now I'm wondering if actually what people meant is having their leaders accessible. So that's interesting. Be interesting to hear in the chat, for those of you who picked that, were you thinking about leaders or were you thinking about the idea that, make your services easily accessible so people don't have to jump through hoops, get pre-approval, go drive somewhere else. Number two is what Trish just said, being proactive. And I will tell you, in my year of doing this, because we have tried everything we can think of. We, scouring the literature, talking to colleagues. We have so many interventions we have tried here. And what I have learned in the past year is, I think the single most important thing is what Trish actually said, is being proactive. You can't wait for your healthcare workers to come to you. You have to go out and you have to assume they're struggling and bring the services to them. And when we go to interventions, you'll see what I mean by that. But if you make available, let's say, here's a phone number you can call, it's free and you can even get a counselor, right? If that's what you do, you're going to miss I'm going to guess the majority of your workforce who is struggling. I feel that most healthcare workers won't spontaneously reach out for that kind of help. But if I'm rounding on the unit and I'm talking to people, they're going to tell me things. So I go up and I hear about someone tells me they're drinking too much. Someone's talking to me about, marital conflicts they're having with all the stress. I've had people tell me about, of course, insomnia. But I don't think any of those people were ever going to reach out to me. And they know me, right? I've been part of the biocontainment team for 6 years. And I go to every staff meeting and I do trainings. And even so, and of course, I'm trying to support more people than just that team now. But even those people, sometimes I'll get an email. But when I'm there in person, then they'll tell me. So that is the clearest example I can give of why we have to be proactive. We can't just say, here's the resource. No, go ahead and use it. So I think, our participants rated that number 2. And then going back to the first topic about stigma, right? We're healthcare workers. We shouldn't need help. Is creating an environment in which services are not stigmatizing. All right, I'm dying to hear the answer to the, was easily accessible meaning leaders, or do people mean the services themselves? Amanda, did anyone clarify in the chat?
There were a couple people, and it's pretty split. Some of the responses we've gotten will show you both ways. So the first one I wanted to bring up is really leaders being present. So walking with, beside the staff instead of over them. So I'll pause with that one real quick.
No, that's Trish. Do you want to comment on that as a nursing leader?
I will tell you, it's hard. It's hard because you're in there and you're with people and you want to walk beside them and you want to help them, but yet you still have to hold them to standards of care. So you're like really torn between, I know this is really hard and really rough, but can you please document your skincare? And can you please make sure that, you've up to date on your eyes and nose kind of thing. So it's a real tough balance. And you try not to, because everybody's fragile. Everybody, is having rough days. Maybe everybody, hopefully not everybody on the same day. But I think that there's a real fine line here is how do I empathize and how do I maintain order in my unit or with my staff? And I think, I think sometimes that's hard for people to realize that their leaders are kind of on that precipice too right now.
It's such a great, insightful comment. Thank you. Amanda, other thoughts from the participants?
There's a couple around staffing or peers. So one part of this is how do I maintain compassion with staff who choose to maybe not get vaccinated or be responsible out in the community and are out several times for that possible community exposure time. And then also hearing resentment from staff about when staff are coming back to their home units after maybe traveling, really resentment about, well, what about us who stayed? And those kind of comments.
Yeah, that is a challenge for a leader. Trish, I guess I'll kick that back to you, but creating harmony in a team where there may be some divisions. I don't know if you're seeing that in Bellevue, if you have people who've left to travel and then coming back.
No, we didn't. I will say that I've heard that in other facilities, but not at Bellevue. But, we've had a few people go out with community exposures. And I think that that's a really tough one because you hope you instill the, I'm going to say, PPE values of masking and social distancing at work that kind of spill over into home, but you can't monitor that situation, and it's hard, but I think it's something we all have to live with right now. And I think that, and when staff starts to get resentful, it could be, they could have had the same thing, like riding the subway home or didn't wear a mask around their grandmother. So I think that that's a really tough one, because you can't penalize people for this. You don't want to, but you want to make sure that you've got this cohesive unit. It's a tough line to walk again.
Yeah, and in an ideal team, a team can kind of hold differences of opinion and hold different values and sort of function with that, and there's a respect for difference. And I think, what a leader tries to do is remind everybody that we all come from different backgrounds. We all have different families, different cultures, different values. And rather than jump to judgment, try to, assume positive intent in the other person. They're in healthcare too. They want to help people. And don't make too many assumptions, whether it's someone becoming a traveler, but, who knows what their financial situation was. And similarly with community exposures. So it's not easy, but I think that's the, what we try to do is to turn down the temperature by reminding people that we're all human, we're all fallible, we all come from different places. I'm concerned about the time. I want to make sure we get to our other questions. So Amanda, unless if there's anything else you want to shout out, but then I think we should probably get to the next question.
Yeah, we'll do this last one. It was kind of a twofold of help with destigmatizing behavioral health services, and then helping those staff who think they're okay and won't reach out, but actually knowing how to tell them that they're not okay, or helping them, identify triggers or things like that. And then we'll move on.
What a great segue to what's the most important message for leaders to convey to healthcare workers? Because this is all about stigma and about, making it okay to access services. So, Trish, you want to kick us off with this one?
I think, I think that it's important for a leader to say, I'm going through this too. I don't have to share my differential diagnosis, but I can tell them, I submit toothpaste underneath my pillow because I'm afraid that I'm going to get COVID. And yes, I've read about the variants, and you may not understand it like I do, so let me explain it to you, kind of thing. So I think just the most important message is that, I'm going through it. I was beside you. I still continue to be beside you. And we both are having the same issues and problems. The stressors may be different, but the problems are the same.
And that actually, that's what what you are saying is the number one thing here, right? You are not alone. I remember when we were preparing this and you kind of rattled off messages, and those are the options we put in the question. And the one that you're focusing on is the one that the single most important one that our participants identified. Don't be embarrassed to ask for help. Feeling badly is not necessarily a mental health diagnosis, but maybe an occupational hazard. Other messages, and then we'll talk about leadership, and we'll get to the question, the chat from the last question about stigma and how to sort of overcome these obstacles for people accessing services. But Amanda, any additional messages from the chat that people contributed?
They're just agreeing and saying that we care and appreciate them.
That's great. So letting the healthcare workers know that we appreciate them and we care. And this is great because every chat completely foreshadows the next thing I'm going to say. So let's talk a little bit about leadership messaging. And here's my favorite quote about leadership. Like, everything you need to know about leadership is right here from Will Rogers. When people are stressed and upset, they want to know that you care before they care what you know. We can put all these trainings together and teach people to do deep breathing and gratitude journaling and stress management, but unless they believe that their leaders care about them, truly care about their well-being, all of those other things will be of marginal value. And so I'm just going to share quickly the results of a really nice study by Tate Shanafelt at Stanford and his colleagues. And they, in the beginning of the pandemic, interviewed healthcare workers and asked them what they were worried about. And they categorized their concerns into 8 sources of anxiety, and then they boiled that down into 5 basic requests that healthcare workers make of their leaders. So the 5 requests, the first one is prepare me, right? Help me be ready for what I'm facing. And that means clear, current, honest, accurate information. We talked before about trusting leaders with information. Via town halls, staff meetings, email, video messages. Again, one of the participants mentioned how hard it is to, the flood of communications. What kind of signal can separate from the noise, as it were. So preparing people with information training to support critical knowledge, timely information about caring for COVID, access to experts. Like here, I don't know if Bellevue did this at Nebraska Medicine. We have PPE extenders on the units. They help the staff. You're shaking, so you did the same thing. Don and doff the PPE, so they don't kind of worry about it. So we have experts to help them. So that's being prepared. Second key request that our workforce is making of us is hear me. I want to know that I'm being listened to. So we have to create feedback channels for two-way communication. We have to include healthcare workers in decision-making and creating new protocols. That doesn't mean every single, one of your 10,000 employees of your big system like we are, sits at a table, but it means having the opportunity for people to message up to their leaders and their leaders to get to the committees making decisions and then communicating back and doing that sort of an iterative process. It means, as someone just said in the chat, validating the stress and the mental health effects of the work we're doing and expressing awareness and gratitude for that work. So prepare me, hear me, protect me, right? We have to get adequate PPE. We have to provide people rapid evaluation, COVID testing if they had an exposure, even potentially accommodating healthcare workers at high risk so that they can feel safe or not spread to their families if necessary. Support me. So, organizations that even do little things like providing food and, drink up on the units, or that have a behavioral health provider go round on the unit, the message that sends is we support you. There are a lot of things organizations can do. They all have a cost. So you can't do all of them. You have to think about what you're capable of doing, what you can budget. But for example, when people are working long hours, can we help with lodging? Can we help with transportation? One healthcare organization in a dense urban area, for example, made bicycles available for free and also gave up free parking so that their staff could avoid public transportation. What's the message that sends? It says, we care about you. We want to help you get to work safely. Childcare, meals, laundry service. We've talked about doing that. What can we do for some of our leaders who are working all these extra hours? Can we even take care of some laundry for them? So again, you can't do everything, but you want to think about what, as a leader, you can do to support your teams. There are other examples here. And I want to mention, other resources. I'll mention that a little later, actually. So I'm going quickly through things, but there are resources you can look at to get more detail. And finally, care for me. So if I do get sick, if I do have to quarantine, take care of me. What does that mean? So if I'm quarantining for a high-risk exposure and I don't want to be with my family because I'm concerned about their health, can you help with lodging? Can you help me with meals in that case? Providing emotional and psychological support. Every time we have a healthcare worker who is put in isolation for testing positive or put in quarantine for a high-risk exposure, one of our behavioral health responders reaches out to them and says, we understand this is going on. We're here for you. Let us know if you want to talk. That demonstrates caring. They are asked in employee health if they're receptive. We don't just violate their privacy, but say, we'd like to have someone reach out. Are you okay with that? And most people say yes. And the other thing I wanted to say about leadership is putting together an organizational wellness work group. So a group that will coordinate this response plan in terms of wellness and healthcare worker well-being, including representatives from various disciplines, behavioral health, chaplains, human resources, various operational departments. And I mentioned before, you got to focus both on the individual factors, like what kind of support for individuals to help them with their own stress management, but also those institutional factors about work hours, mandated overtime, parking, all those things that also affect wellness. This group would adapt to changing circumstances, can collect data on the interventions and the response to them. We have frequent surveys we're doing to check in with our staff, for example, and then ensuring that resources are well publicized. Let's talk now about interventions. So we're getting a little short on time. And I know, can you remind me how many minutes we need to leave at the end, Amanda?
Just one or two.
Just one or two. Okay. So one way to think about interventions is in 3 tiers. So there are, and this comes from the Institute of Medicine's model for categorizing public health interventions designed to prevent negative outcomes. And in our case, we're talking about negative psychological outcomes. So there are universal interventions. These are things designed to reach an entire population. So if you're Bellevue Hospital, it's your entire workforce. So it could be like 10,000 people. Selective interventions are designed for people who you know to be at higher risk of psychological distress. So these are things you would do for people, for example, your ED workers or the workers who are on your COVID units. And then indicated, the idea here is that for people already showing signs of psychiatric illness or psychological distress, what do you put in place for them? So it's a preventive framework, but at the top of the pyramid here, sometimes you can't prevent. People are already showing signs, so you got to address it for them. And I just want to make the comment that everything I'm about to talk about really quickly, because of our time, is covered in more detail in a talk I just gave a month ago. It was actually April 30th. No, that's today, March 30th. It's on YouTube. We'll make these slides available. You can see the link. So I'll give you a little more information because I'm going to go quickly. And then also we have resources in the resource repository in the second link to help you actually develop your own resilience training, your own peer support programs, including PowerPoints and actual videos of the training that we gave to our teams. So tier 1 universal interventions. And we mean universal, right? So you're including your supply chain. I mean, these folks are stressed out too, right? They're trying to procure difficult to get PPE, environmental services. These folks are cleaning up in those COVID rooms after patients leave. Your lab, they're handling viral samples. Your IT folks who are constantly updating your electronic health record with new protocols, et cetera. So we already talked about leadership principles and strategies. Another is to provide resilience and stress management training. Again, there are models to do it, and we have an entire kind of package you can look at in that second resource that I provided, including a sample of a training of what it looks like. I have the PowerPoint that we use, but we do these 50-minute, 60-minute webinars. We've done over 80 at Nebraska Medicine for different groups. There's universal peer support programs. University of Minnesota Medical Center, I don't know if anyone's on from there, has done a nice universal peer support during COVID. We have resources on that in that first YouTube video, if you watch it, more about that. And then collecting whatever you do for your workforce, a centralized repository, one place where it's all there. And you can add additional tip sheets and links to websites and apps, Headspace and Mindfulness Coach and CBTI, which is an app for people with insomnia that's free and high quality. All this information you can put in your resource repository. And there's more information about that in our YouTube video that we're going to link for you. Targeted peer support, rather than universal, this is doing things like reaching out proactively to people in isolation and quarantine, like I mentioned before. We've proactively reached out to all of our hospitalists, to our trauma surgeons. We've proactively reached out to any nurse that had a patient die on a COVID unit because we know how traumatic those deaths were, especially in the beginning of the pandemic, no visitors. And we were really struggling to figure out how to help that nurse. So targeted peer support, behavioral health liaisons, I mentioned that before, you embed a behavioral health provider with a high-risk team. They go to the staff meetings. They take 10 minutes of a 50-minute meeting to teach some stress reduction activities. They round on the team. So you reduce some of that stigma. You reduce some of that, it's so scary to ask for help. I know this person. This is my go-to person. And the person approaches the team. How are you doing? What's been the toughest thing for you recently, right? So we open up those dialogues. We talked about support groups, support centers, the idea of having a room adjacent to a unit that's high risk with food, with relaxing music, and maybe even a behavioral health provider at for particular times. You can leverage your spiritual care teams. Mount Sinai Health System has groups that their spiritual care staff lead, and things like finding meaning, coping with grief. Strategies to prevent moral injury is a whole other topic, but that is covered in the YouTube video that we talked about. And then screening and referral programs. There's great online anonymous programs. MindWise has one. American Foundation for Suicide Prevention has one. People anonymously take a screening test. They get a result. And depending on the program, an actual person can email them. But it's all confidential because the person sets up an account password. So it gets to their email, but the person reading the results and responding doesn't actually know who the person is. And they say, you scored high on this, in depression. Here are some resources. Would you like to talk about it? Again, more information in the YouTube video. And finally, for people already showing symptoms, we want to do things like create a referral line that's confidential. You don't know where to turn, just call this number, So we have a number like that here at Nebraska Medicine. Anyone can call it. What's your insurance? What's your problem? I'll match you up with a provider. And then within your own organizations, if you're a large health system, you can prioritize your own workforce for services, for behavioral health services, as we have done. So I'm aware of the time. I know there may be questions. I don't know, Amanda, if you want to do some closing remarks or if there is time for any questions.
I think we were able to cover everything, but I know Trish has something she wants to say, so I'll give her that chance and then we'll
just
move on.
Give me a minute. So I just wanted to say, somebody said something about you guys getting a certificate of appreciation. And at first I laughed and thought you'll get CEUs at the end. But I wish I could give everybody on this call a piece of paper to say how much I appreciate you. But no, in my heart, I do.
Thank you, Trish.
Oh, thanks, Trish. So I think we were able to answer everything. I would like to take a second to piggyback off of Trish. One, to thank our speakers today for the wonderful wealth of knowledge, and then for our attendees who really contributed and gave us a robust discussion. So thank you very much. So as David mentioned a couple times, we do have some resources, and NETEC is here as well to help. If you have questions about anything today in the webinar or anything maybe not even related to a topic that we talked about, please feel free to send your questions to info@netec.org. We'll be happy to get you someone to answer those, subject matter expert. Also, if you have other types of requests, there are other ways to do that. For instance, for a technical assistance request on our website at www.netec.org. Next slide. Also, join us in the conversation. We're on all the social media handles, so please follow us there. We do have online courses at courses.netec.org. Also, we do have skill videos on YouTube as well. And then our repository that I'll touch on quickly is located there at the bottom of the screen that has a wealth of resources as well. Again, thank you so much for joining. Thank you for our speakers, and have a great rest of your afternoon.